P1 class. I hope you are doing well today. I am Dr. Emily Flores. I wish I could be there with you in person today, but I'm at a health clinic in Tazewell, Virginia, doing some rural patient care there. So I hope you're doing well today. I wanted to take just a minute to talk with you about the rural service hours that you'll complete as a part of your IPPE this year during your P1 year. My contact information is right here for you, so I've kind of highlighted that. And I am your contact for this. Please let me know any questions that you have at any point. The goal of these rural service experiences are so that all of our students do have an introductory rural health experience. If you'll recall, the mission of our College of Pharmacy is to develop progressive, team-oriented pharmacists that improve healthcare, focusing on rural and underserved communities. And this gives us a way to really show that we are getting that focus piece in there for you all. Through these, you'll better be able to recognize some of the social determinants of health. And we as a team are working towards finding ways to reduce those health disparities that are in our region through establishing and working to further establish specific community partnerships. The specific objective with this is to be able to tell the story of an individual in rural Appalachia whose social determinants of health have impacted their care. And yes, I'll help provide you some reminders of what the social determinants are, but you'll also get those in your classroom sessions. Many of you may already have some background that tells you those things. So you have this wonderful graphic here that shows you this rural service experience as a part of your professional service. Each of these experiences are over 2 hours long, and you are expected to come to the entirety of the experience that you get to do. The rural services focus on meeting those unmet healthcare needs in our area and kind of prioritize some disease states that are even more impactful in our region, including substance abuse, but not limited to that. And the partnerships that we are serving in here are strategic, and we're working to develop those more. Again, contact me with questions. This is an experience that you are assigned to based on your learning group. So if you look around and see those in your learning group, that's who you're going to be working with for this. Once you're assigned that experience, you are expected to be there. Be prepared, be professional, be there for the entirety. These are important partnerships to us, and we're glad to bring you along as we work together in this area. There's some information here on should something go sideways for you, so that you can kind of figure out what to do. But hopefully you'll all be able to do what we're asking of you. There are additional rural hours that will be available beyond those that are assigned, and you may use those for your other professional service hours if you want to. Follow appropriate documentation of hours. The rest of the team will talk with you about that. For the rural hours, you will need to complete a reflection on them, and I'm asking for that within 30 days of the activity. That is its due date for 2 reasons. One, I want you to be able to reflect on what you've done and really tell the story of that patient while it's fresh. And 2, I want your feedback. I want you to tell me how the experience went, if it's good, bad, or otherwise, so that I can improve, because there may be classmates and other learning groups coming behind you to do similar experiences. So the full details about those reflections will be on D2L. And then finally, the much-awaited schedule. So, few things. Column-wise, learning group, then a quick description of the experience, the date and time, the location, and other information. The only date and times that I've highlighted are the ones that happen in September, October. I wanted to draw the learning groups that have the first experiences really to those. Make sure that you get them on your calendar now and plan accordingly. I also wanted to kind of explain a little bit about the experiences. One piece to start out with, in this additional information column, if your group is split between 2 experiences, it tells you that here. So for example, all of group 1 is going to participate in the drug take back day in October, but you're going to need to split between 2 different sites. You'll have some other P2s and P3s at the sites with you as well. So you, among yourselves in your learning group, you decide which 2 of us are going to go here, which 2 are going to go there, which 3 are going to go here, which 2 are going there. And these numbers are very strategically done, specific to meet the needs of the overall partnerships we have. And so drug take-back days, quite a few of your groups are doing drug take-back days. Those are days where, you know, a big blast is put out to the community and said, hey, come to this location, bring your drugs. Clean out your closet, clean out whatever, bring your drugs. We'll log them and safe dispose them. So you'll have multiple opportunities to talk with people there and actually see what medications are out there in our communities that we can take back. And so this happens in October for the first 3 learning groups, and then groups 4, 5, and 6, you'll do the same thing, but at the April dates and locations. Next up, we have participation in RAM events. And so we have a big showing at the RAM that happens in November in Gray, Tennessee. And multiple of your learning groups will participate there. So groups 7, 8, 9, and 10 are going to participate there in the interprofessional student teams. On Friday of that week, you will be out of class at noon, at 11, so that you can get to this site by noon. Dr. Hurley was kind enough to move his class up into your exam block that day, so make sure that everyone realizes that schedule change. At the event, you're going to work with other healthcare professionals, talk with patients, help get them to the right booths, do some health screens. Yes, you're early in your education, but you will be able to really be of value added at this event and find someone to really meet. Then naloxone training. So groups 11 and 12, you'll participate in naloxone training at that RAM event there in Gray, Tennessee. And so that's noted for you. And then group 13, you'll split time slots, but the whole group is participating in naloxone training at the RAM in Jonesville, Virginia. And so we do want to make, you know, you've just done your naloxone training. We want to make sure that you have an opportunity to use that. And then groups 14, 15, and 16, you'll be split up a little bit based on dates. And either myself or Dr. Jeff Lewis will be with you at this. We are offering the diabetes education class to patients at the Providence Clinic that have diabetes and live with it. We want you to come, observe, learn, talk with the patients, and then we'll also get your help logging some medications and kind of doing some of the medication management stuff, inventory management stuff that we need to do at that site to help them. This Providence Clinic site's a very intentional relationship. They serve the underserved, and we're looking forward to really growing that this year. So thank you, everyone. Thank you for your time. Please let me know what questions you have or the rest of the staff faculty that are here. Thank you.